Chapter 14, Injury Prevention, Part 1. Chapter 14, Injury Prevention, Part 1. Identify strategies for injury prevention. Identify common injuries related to physical activity. Analyze the mechanism for injury in each body segment. Determine common risk factors that can lead to injury of each body. Specific injuries. Specific injuries, such as ankle sprains, anterior cruciate ligament injuries, low back pain, and shoulder pain, create an enormous challenge to athletes and training professionals alike. Athletes in sports that require cutting and jumping are particularly affected by injuries due to overtraining, poor neuromuscular control, arthrokinematic dysfunction, or improper biomechanics. The number of injuries to areas such as the foot and ankle, knees, hips, low back, shoulders, and head and neck are staggering, necessitating a comprehensive programming strategy to help prevent injury and return athletes to play post-injury. The most important goal of the sports performance professional is to prudently prepare the athlete for the rigors of competition. This chapter will review common injuries that occur in athletics and provide guidelines for prevention. Pre-activity warm-up for injury prevention. The purpose of warm-up prior to physical activity is to optimize performance, prevent injury, and arouse physiological acuity. Warming up, as the name implies, results in an increase in core body and muscle temperature. The physiological outcomes of warm-up that drive the potential to improve performance include increases of peripheral blood circulation, increases of soft tissue elasticity, increases of synovial lubrication of the joints, increases of oxygen uptake kinetics, increases of adenosine triphosphate turnover, muscle cross-bridge cycle rate, increases of muscle fiber conduction velocity, decrease in viscosity of the intermembranous lubricants, also cardiac trauma from sudden strenuous exercise. An active warm-up is defined as any submaximal activity that facilitates a 1%, 1 degree Celsius increase in the body's internal core temperature to physiologically prime it for a maximal visceral efforts. This type of temperature increases require minimal effort. The warm-up protocol should not cause fatigue. That might impair performance and lead to possible injury. Rather, warm-up protocols must elicit the internal physiological changes necessary to promote performance and prevent injury without overtaxing the athlete. Pre-activity warm-up for injury, page 463. Pro tip: once a mild sweat is broken, the individual should be sufficiently warmed up, regardless of training status. Warm-ups in high heat or high humidity environments should be modified appropriately to avoid heat related illness. The transition phase is the time between the end of the warm-up and the start of the workout activity. The ideal transition phase should permit a smooth transition from the warm-up into the workout, one that allows for a short 5 to 10 minute rest period without cooling the body too much. Fatigue may occur if too little rest time, 1 or 2 minutes, is allowed after the warm-up, whereas too much rest, 15 to 20 minutes, will negate the benefits of the warm-up protocols. Research and focus. The temperature of muscle begins to decline immediately following the cessation of muscular activity. Appreciable declines in muscle temperature occur as early as 15 to 20 minutes post-warm-up. The longer the time period between the ends of the warm-up and the start of the activity, the more the active warm-up benefits ought be offset. Practical, passive heat maintenance modalities have been shown as an effective means for reducing the decline in muscle and or core temperature. During lengthy transition phases, such as between multiple races, at track or swimming meets, passive warming up techniques may provide a means to maintain elevated muscle and core temperature. If the lifting protocol prescribes, pro tip, if the lifting protocol prescribes a moderate rep range, the actual lifting of the first couple of repetitions can function as an adequate warm-up. Performing a set of 10 reps executed in a 2:02 tempo would allow approximately 40 seconds of warm-up prior to maximal effort. This is more than sufficient in preparing the lifter's body and mind for maximal intensity attempt on the final repetitions. In contrast, if the lifting protocol prescribes the lifting of maximal loads, less than 5 repetition maximums, it is recommended that 1 or 2 non-fatiguing warm-up sets are executed prior to the heavy training sets. Warm-up protocols. A warm-up strategy should also be used for extended breaks in athletic events, such as halftime breaks, which may last for 12 to 15 minutes or more. A brief sub-maximal active warm-up involving activities such as repeat sprint drills or continuous running during or after a halftime period elicits improvements in repeat sprint and second half performance. Warm-up strategies should include a sub-maximal non-fatiguing activity, stretching, sport-specific movements, injury prevention techniques, a gradual progression in the intensity level and movement specificity for the activity. Increase in speed from half tempo to game pace by the conclusion of the warm-up. Epidemiology of foot injury.